So thinking again about treating reduced dorsiflexion of the ankle. This time we're going to come at it from the posterior chain, and the main aim of treatment here is to encourage lengthening of the gastrocnemius and Solaris. If these muscles are short, that will inhibit the amount of dorsiflexion available at the ankle joint. So looking at treating gastrocnemius and Solaris, a variety of soft tissue release techniques and active release techniques are very effective. So first of all, I can apply a nice broad loose contact via the fist and just work slowly superiorly up through the calf compartment, and at the same time I can ask Chris to just actively dorsiflex and plantarflex. So Chris, if you can just move your ankle backwards and forwards, that's great, and just keep that movement going. This works very well at releasing any adhesions between the fascial layers, particularly the interface between Solaris and gastrocnemius that can get very tight. How's that for pressure, Chris? Is that okay?
That's good.
So work here needs to be fairly slow. It's quite deep work. If you work too quickly, what will happen is that you will end up just scooting over the top. So just making sure that you have a nice deep contact and working through the tissues. And you can work all the way up through into the upper fibres of gastrocnemius up to the knee. And we'll stop there and move on to something else. So another very effective way at trying to improve dorsiflexion at the ankle while stretching the posterior muscles, soft tissue release. So coming in with thumb contact and just sinking into any fibres that feel particularly tight, so particularly through this lateral border of the gastrocnemius and Solaris. So fixing in and just using my chest to encourage dorsiflexion at the ankle. So focusing a bit more into Solaris, that tends to get the bulk of Solaris in the bottom half of the calf, and moving into around the muscle tendon junction with the Achilles. So I can extend work down from muscles into the tendon. So people coming in with Achilles tendon problems, using soft tissue release, particularly getting the sheath gliding better, so a thumb and forefinger contact either side of the tendon, and again just using passive dorsiflexion at the ankle. I can feel here there's a bit less glide through the medial border, so I'm going to just focus a little bit more through here. So combining tissue work with movement. Again, just with the Achilles as well, just with the ankle in a dorsiflex position, just see how well the tendon kind of glides, and just using thumbs either side of the tendon, I can just slowly glide up either side while again just dorsiflexing the foot. So similar idea that we applied to the calf muscles, we can now apply to the Achilles. Obviously you wouldn't use this type of direct technique on an Achilles that was suffering from acute inflammation, usually in the tendon sheath. So this is particularly good for Achilles that are suffering from tendinosis, so that kind of degeneration within the tendon. You usually get thickening of fibres, not necessarily any active inflammation around the sheath. This works very well. And then finally moving down through the chain into the plantar fascia. So again, staying with the idea, the theme of increasing dorsiflexion through the foot, and come in here and fix in with the thumb. Into the plantar fascia, and again encourage dorsiflexion through the ankle. So we have a theme of working through the posterior compartment, encouraging the ankle to stretch and dorsiflex from muscles, Gastrocnemius, Solaris, into the Achilles and down through into the plantar fascia as a chain.